Welcome, everyone. I'm going to get us started, even as you're all coming in. Good morning, good afternoon, and good evening. We are so pleased to be hosting today's discussion on building country-led ecosystems to scale global health innovation. I wanted to say thank you to Jordan Morrissey and the team at AMP Health for initially proposing this timely topic. It's been exciting to shape this discussion together with leaders from member organizations eHealth Africa, AMP Health, and Google. My name is Abby Kosan, and I am the Deputy Director of the Bay Area Global Health Alliance. For those of you who are new to the Alliance, we are a global, cross-sector membership network of more than 100 organizations, bridging technology, industry, finance, and traditional global health. Today, only 1/4 of our members are based in the Bay Area. We continue to embrace our Bay Area roots and the region's innovation ethos, with 40% of our members focused on tech and digital health. The Alliance was founded on a simple idea that no one sector or organization can solve complex global health challenges alone. We found that in this time of uncertainty and rapid change, a trusted community is more important than ever. We see ourselves as a connector, neutral convener, and sense maker, creating space for people who don't always sit at the same table to connect, learn from one another, and move ideas forward. Together, we explore AI applications for global health, financing and investments for global health, and help members navigate an evolving global health paradigm. A few virtual housekeeping rules to keep in mind. This is a Zoom meeting. Please mute your microphones and feel free to use the chat to ask questions and connect with other attendees. We will monitor the chat for your questions, and we have held time for Q&A later toward the end of the discussion. This program is being held under Chatham House rules to encourage open and candid discussion. Please be respectful and do not attribute comments or insights without consent. This meeting is being recorded, and we will share an insights report following the discussion. Aliana, if you can advance the slide, please. The old playbook for global health innovation, designed primarily in the global north and deployed elsewhere, is giving way to something more grounded and more complex. Systems shaped by countries themselves, with governments, local institutions, and private partners increasingly setting the terms. And it looks like Aliana's screen froze, so we'll get the slide advanced in just a minute. Accelerating AI and digital transformation are surfacing new opportunities and risks at exactly the moment when countries are asserting greater ownership over their own innovation priorities. That is pushing every global health player to rethink how they partner and engage, particularly if the goal is innovation that is sustainable and can scale. Today, we are so fortunate to be joined by Akhigbe, Director of Partnerships and Programs at eHealth Africa, who will serve as our moderator. Atta is joined by Abdoulaye Diak, Program Manager, AI and Machine Learning at Google Research, Reese Johnstone, Director of Learning at AMP Health, and Chioma Ogbazar, Leadership and Management Advisor at AMP Health, all of whom bring impressive experience. You can learn more about each of them on the event page link, which we'll drop in the chat. Thank you all so much for joining us. Without further ado, I'll hand it over to Atta.
Thank you, Abby, and thank you to the Alliance team for putting this conversation together and for the trust to moderate it. It's really good to be in this room with all of you. Thank you for that introduction. Like Abby said, I am the Director of Partnerships and Programs at eHealth Africa, and we work across the continent on integrating digital public infrastructure into national and subnational health systems. Much of our work sits at the seam where ambitious innovation meets institutional accountability. So this is a conversation I spend a lot of time inside and one I hold personally, not just professionally. So I'm really glad we're having it together. I came back from school last week where I co-hosted a conversation on scaling through government from innovation to national impact. Now, what stayed with me from that room was a clear recognition that the playbook is changing. the model where solutions are designed elsewhere and deployed into countries, with country leadership treated as a step in implementation rather than the foundation of the work, is no longer enough. What is coming up in its place is more grounded and, frankly, more demanding. It's a shift from country ownership as language to country ownership as architecture, from innovations being delivered to a country to innovations being shaped, owned, and integrated by the country. From scale defined only by reach to scale defined by whether the system can carry the innovation when the original partner steps back. I think many of us in this room are sitting with some version of that shift. The harder question is no longer whether an innovation works in a pilot. We have learned how to do pilots. The harder question is what happens at the seam between an innovation and the institution that has to carry it. What does it take for a digital tool, an AI model, a leadership intervention, or a financing mechanism to move from this works to this now belongs inside how a country runs its health system? That is really what we're here to look at together today. And what makes this conversation useful is that we're not asking the question in the abstract. We have two organizations doing different parts of the same puzzle, both grounded in real work in Ghana and across Africa. Google Research Africa is helping shape what AI looks like when it is designed with rather than for African contexts, meeting people where they are and building infrastructure that local innovators and governments can build on. AmpHealth is doing the often less visible work inside government, the leadership, coordination, and embedded support that allows innovation to move through a public system, not around it. And of course, the Alliance gives us the right room for that conversation because no single organization and no single sector gets to own this shift alone. So my hope for the next 50 minutes is simple. Let's make this practical. Let's keep this very practical. Let's stay one level below the language. And let's be honest about what is working, what is harder than expected, and what is easy to underestimate when we try to do this well. Riz, let me start with you. Because the leadership and coordination work AMP does is often the first thing that has to be in place before anything else can move. AMP Health supports governments to build visionary and effective teams. Can you very briefly introduce AMP's model and leadership approach to ground this discussion?
Thanks so much to Abby and Sarah for creating the platform for this really important conversation. And also for that introduction. I found myself nodding so hard, I was worried my head might fall off. AMP Health has been supporting government health teams, mostly in Africa, for more than 10 years. Our focus is on developing the people in the systems, and we do that in a variety of ways, but the approach most relevant to this conversation is embedded support. We embed mid-career professionals, preferably with a mix of private and public management experience, for 1 to 3 years, full-time with the government team. They sit in the office with the team, they go out into the field with them, they walk side by side with that team and share their struggles and successes. They become a trusted coach, not just to the team leader, but to the entire team. We use an experiential learning model in which the team learns new skills contextually while doing their everyday work. There's no PowerPoint, there's no classroom. The team learns through activities based on their programmatic goals and challenges. We see every moment as an opportunity for learning and growth, and the MP's role is to provide just-in-time coaching and feedback. The management partners are supported by myself and other members of our global team who provide logistical and technical support. As Director of Learning, I design tailored learning journeys for each team based on their needs and help the management partners to structure learning activities such as workshops, one-on-one coaching, masterclasses, and the like. Sometimes that means going in the country to join the management partner and their team for short periods. And sometimes I provide that support remotely. Thanks.
Thank you. Thank you, Rhys. Let me pick up on one specific point, from your introduction. So AMP describes its model of which the management partner can be a core feature as helping shift power dynamics from global to local toward genuine government leadership. That is a strong claim, and it is the right ambition. In practical terms, what does shifting power actually require of an embedded partner? And what is the hardest part of playing that role well?
Thanks, Sota. I think too often a funder has a project with a goal they want to achieve, and the funding is kind of contingent of their goals, being the government implementing their goals. We flip that model completely. We see the management partner as a coach, not a technical advisor. We start by listening and building trust. We don't enter the partnership with predefined goals. We help our government partners to clarify their goals and then support them to reach them. I think one of the hardest parts is for a management partner to resist the temptation to jump in and fix things that are seen as in some way broken, to do instead of playing the role of coach. But in reality, our government partners are the experts who will find their own solutions. And our role is to be a thought partner, to provide new frameworks for thinking about an issue, to help teams to work better together, but never to dictate a direction or an outcome. I think another challenge is that sometimes the team is actually cross-sectoral, as in the case of this country innovation platform in Ghana. And our role then becomes to coach the system and to help multiple players, such as government, innovators, and funders in the CIP case, to work better together. So in that case, we focus on helping the partners to develop role clarity, effective communication, and mutual respect. That can mean helping the global partner to see when it's better to step back and let government lead. It can also help gently helping government to try new ways of working and making decisions. For the management partner, this takes courage, discretion, and also the ability to manage some difficult conversations. And luckily, we have some really fantastic people who are able to do just that.
All right. Thanks, Rhys. I think that gives us a clear view into the leadership and coordination work behind country-led innovation. Abdullahi, let me bring you in from the technology and ecosystem side. Google's work touches on sovereign AI, local data, and meeting people where they are. But beyond the technology itself, how are you thinking about your role in strengthening the local innovation ecosystem in Ghana? I would start with that.
Thank you, Ota. Thank you for having me. And I will start with giving a bit of context. I've been working for Google for the past 7 years as a program manager, and I joined the lab 7 years ago. The mission of the lab was to leverage AI and machine learning for our local challenges. So that was very appealing to me. I started leading an AI residency program. I wasn't really expected to be involved in health, but it just happened that two of the residents were actually medical practitioners. One was specialized in radiology, and then the other one was specialized in dermatology. And so that's where I saw really the potential and really interesting research. And those are medical professionals who also have an interest in machine learning. And so we now have two labs. We have now one in Nairobi. The lab in Nairobi is focused on food security, computer vision, plant phenotyping using AI, while in Accra, we've been focused on remote sensing, so improving maps using AI and satellite imagery. We've been working on flood forecasting as well, weather forecasting, so nowcasting, getting to know when it's going to rain. And the latest work involves languages. So we released a huge data set of 31 African languages, for voice recognition and vocalization, with the idea of having the ecosystem being able to build and train AI for all languages so it can understand us and also speak all languages. So why am I talking about all of those projects is that it's all connected. That's what I've seen over the years. And so even recently, we've started a collaboration with the World Health Organization in Africa, with the idea if we could leverage our AI models and obviously the World Health Organization knowledge in forecasting cholera cases in Africa using our time series models and also other models. So this has been very interesting, and I encourage the audience to look up the Earth AI models. But this is what I've seen basically over the years.
Thank you. And I know many people in the audience are very interested in what Google is seeing and building in Africa. So to ground us further, can you briefly share how Google Research is thinking about AI health ecosystems on the continent, particularly from your base in Ghana?
Yeah, I mean, the way I see it is we are here to facilitate. Last year, we had an AI and health conference that was remote and on-site. And so we had a lot of people from the ecosystem contributing and showing us how they are leveraging AI. What is interesting to me is that it's almost all the same challenge, which is scarcity of resources, whether it's data or compute and so on. And so the common thing that I've seen is that people are working with a strategy of augmenting frontline workers, whether it's midwives, pharmacists, community health workers. It's all basically the strategy of using AI to augmenting their work. And what I've seen that is successful is that people use technology that is going to reach the most people. So yes, in the West, almost everyone has a smartphone, but that's not the case. As we know, on the continent, there's still a huge amount of usage of feature phones. So if you want to reach people, you have to use SMS technology, and that's what people are using. I've seen also cases of people delivering AI on the edge, so AI that is offline and is still able to work, such as ultrasound machines, for example, for pregnancy. And on the technology side, I see that people are going hyper local. And what I mean by that is that they are making sure that the technology can be understood, or so that's like working on local languages as well. And also obviously the context, the AI system need to be able to understand our context for it to be useful.
Chioma, I'd like to bring you in from the government embedded side. You were on the ground with the Ghana Health Service as an armed management partner, and later as a leadership and management advisor during the establishment and launch of the Country Innovation Platform. Can you describe what that actually looked like day to day? What were you doing, and why was that embedded presence so important?
Yeah, thank you so much for this platform. I think it's quite timely. As an embedded management partner, our main work really, from the context of understanding that right now, knowledge is not one-sided. So all over Africa, you have very talented people. So there is now no need for someone to claim ownership of knowledge, thanks to AI and all the technologies are available. But what is lacking is usually all these experts are so stretched. And it is even worse within the government establishments where they have so many things they need to deliver. And anything from an outsider is usually not a priority, So, and that's where the embedded comes in. So that's why for some people, they usually assume that it is a complete waste of time waiting for government to go through their bureaucracy. But if you want things to get done, then you just have to work through the existing systems and not replicate or set up your parallel systems to make yours faster. Because there are so many avenues to make things faster. So for us as the management partners is to working with that humility, understanding you're not meeting people who do not know what they want. You're not meeting people who cannot do anything unless you appear, because sometimes we see that as mindset of some consultants where they assume that in Africa, people don't know what they want until I show up, and that our work is really to listen because they've lived with all these challenges. Sometimes there are some of the challenges that they have become very blindsided to. So as a partner, you listen and hear the things they are saying and both the things they are saying and those they are not saying, and listen to the policies or the processes that they need and point them out so that things could become more institutionalized. And that way it stands a better chance of, living beyond your existence or even when there is change in government. So that's really what the work is. So day to day, you join in their meetings, you first gain their trust so that when you join the meetings, they don't see you as an outsider. So once you've achieved that, then they get to trust you. Then when we are listening and there is now time for implementation, we begin.
Chioma, you just muted. Can you unmute? I think you might have hit a button.
Oh, okay. I didn't even
Yeah.
touch it. I don't know how it
No,
happened.
sorry, go ahead.
Okay. So yeah, that's really what our work is, sitting there as a partner, listening, hear all the things they are saying, and make sure that nothing is missed in the process of implementation. So that's what it looks like. So we sit in all the meetings, but we don't tell them what to do. We sit in to make sure that all the things they want to get done, that they are doing it utilizing their process, so that way when I leave, it stands a better chance of continuing, beyond us. So which is why CIP, is successful. Thank
Thank you,
you.
Chioma.
Over.
Thank you. Let me pick up on the government-led piece specifically. As I understand it, Ghana Health Service set the outcome areas, selected the innovators, and drove integration into public systems. Can you walk us through one moment where that government leadership made a significant difference, where something went better because GHS was in the driver's seat rather than being treated as another external partner?
Beautiful. So let me give you what they usually say when they see us. So rather than being treated as a rubber stamp, that's the word they use. So I'm giving it out. That's what they do. Once people come in, partners come in, they're like, are they coming to use us as a rubber stamp, which they are happy to sail through if you want? They will give you all the nod at meetings, but they know that once you leave, you've only poured your money into a bottomless pit that will yield no result, So, but they wouldn't tell you that because of the way, the person handled the relationship. So what do we do? So the first thing is to co-create. They know what they want to solve, so we shouldn't come in and assume we know what they want to solve. So the assumption should be that they know what they want to solve, So no matter how bad or how slow we think the process is. So the first question is, who needs to be at the table? What are all the departments that you have? Who needs to be at the table, especially the decision makers that can move this needle. And the needle is this project. So first step is the co-creation. Co-creation from a place of really understanding, co-creation from a place of respect, co-creation from a place of giving them the opportunity to use their voice because they have one. So that is the first step with that co-creation. During the before the co-creation, as a partner, because you're there to really learn and understand what they want, so you would have digested all the important documents that would lay bare the context, and the documents included all the strategic plans that they have. So we are situating it in the documents that even if they don't remember at the point. So because you've done this your own research, so it's easy for you to point them in the direction. So your strategic plan says this. You have 14 things listed as the things you want to achieve under maternal and health, program, and that's what you have chosen. So which ones do you want? So that's really how we went about it during the co-creation, having all the right people, choosing from the documents they developed, and that way you hear them speak and you pick the things you want to work on.
Thank you. Thank you so much, Emma. I appreciate that. Rhys, you've designed learning interventions for senior government leaders across multiple countries. What did you see in Ghana that suggested the standard training and capacity building playbook was not going to be enough?
Thanks, Otta. I'm not sure that we ever use a standard training and capacity building playbook. We like to think that we meet people where they are and sort of build on an existing foundation in the ways that Choma has laid out. Having said that, I think Ghana was special in some ways. I think the first thing to point out is that this wasn't our first time working with the PPMED division at the Ghana Health Service. We had a long history with them, previous projects, and so there was a really strong relationships and some acceptance of our model and understanding of how we worked. And that the other thing to say is that Choma's right. All governments know what they want, and we need to listen to them and allow them to choose the outcomes. I think in the case of the Ghana Health Service, though, in addition to that, they already have very strong, mature processes and structures, and are reasonably well resourced, actually, on if you look at a scale across the continent. However, in this case, there was a structural issue in that this innovation world is so different to the world of government. You had two completely different kind of ways of thinking, and there was no structure for the innovators to interact with. And so something that GHS figured out pretty early along and Choma helped them with was the creation of an innovation desk at the national level, which was then replicated at the state level for the specific implementations. And I think that was something quite new in that typically we work with sort of pre-existing teams, a malaria team, a non-communicable diseases team. In this case, a new structure was actually created to manage this innovation process. And to create this bridge between these two very different cultures of the innovators and government officials. And that was really fascinating to see.
Thank you. Thank you so much, Rhys. And first of all, thank you all. I want to pull on two threads that have come up across what each of you has shared. Country ownership and speed are often in tension. Governments move at government pace. Innovators move at startup pace. I mean, Rhys just touched on this. Donors often move around reporting cycles. So how has that tension managed in Ghana, and where did you have to make trade-offs? And Abdullahi, I'd also be interested in how a company like Google thinks about that tension when the technology cycle is moving very quickly, but health systems need trust, need safety, and need continuity.
Yeah, thank you. I mean, the way I see it's mostly us enabling research because that's where things start before even implementing. And I think, having open models like MedGemma can be helpful if you're trying to build on services. You can, for example, skip the very high cost of pre-training because our model are already pre-trained and they can be fine-tuned to various services. And so I think for us, it's more providing the space for people to innovate and experiment. And this is what we've done over the years.
Thank you. Reese, I'm back to you again. You've worked across a wide range of countries. Are there conditions in the current global health environment with funding constraints and structural transitions that actually make the country-led model more viable now, not less? And Chioma, I'd invite you afterwards if there's anything you'd like to build on what Reese says.
Thanks, Otta. I think I could answer this question in two ways. I think the one answer is that in some ways, this sort of question of government ownership versus global funding is a false choice. Public health is a global concern and deserves global funding. Malaria doesn't know borders, but at the same time, governments should lead in making decisions around what problems should be tackled in their countries and how. And these two things are not somehow shouldn't be a choice we have to make. And I'm not saying that's what you suggested, but I think that is sometimes the narrative. I think another important thing is that this issue of lack of resources is not new. Yes, there's been a recent cut in funding, but governments in Africa have been struggling with inadequate resources for public health for decades. Some of the teams we've supported don't even have desks and chairs to sit in, let alone laptops and proper connectivity. Salaries are poor. There's often not funding for activities. This has been the reality that many of the teams we support face, even before funding cuts. And so, faced with this reality, we often have a conversation with them around how to respond. What we believe is that if they can see that they actually have the agency, and it's up to them to identify what is within their sphere of control and what's in their sphere of influence. I mean, that's literally an exercise we take them through. There will always be constraints, but given those constraints, what is within their control and how best can they allocate and steward their resources? And how can they make the case for resources, both from their superiors within the department, from their colleagues in the finance ministry, and also from funders and partners. And so I think, if we see this through the lens of agency and ownership, then the relative level of funding is that is the reality that we need to then deal with.
Thank you.
Thanks.
Chioma, do you want to add anything to that?
Okay, thank you. Yeah, from Annie, if to provide the inside perspective, when you have limited funds, that's when it's even more important for the countries to decide what they want to have external people support them on, so you don't waste your money. Because once they are not in on it, you've only wasted money, but they wouldn't tell you, So, and they will be making demands that you just know is not geared towards achieving the result. So, to answer your question, in addition to what Reese said, to really help in achieving real results is to make sure that we listen to them, and know exactly what they want. There are so many challenges, like Reese has mentioned, but they are aware of the ones that are of utmost importance, compared to others, and they are the only ones that can tell us. So if we don't ask them, they may not, and if you don't gain their trust, they may not come to a place where they'll be willing to share that with us, because sometimes the issue is not just about the money, it's about clarity on what I want done with you, not for me. So yeah, over.
Thank you. Thank you, all three. Before we open up for questions, I want to thank everyone who submitted questions when they registered. They were very sharp, and several have already shaped where this conversation has gone today. Let me bring one of those in to start, and then we'll open the floor to any more. And if there are any live questions, we had a question from the Tanzanian Ministry of Health about interoperable systems, data governance, and scaling AI. So when AI shows up in a government environment, the question is, what does it actually take to move from a tool a vendor brings to a system the ministry owns and runs? So if I were to frame this differently, I would say I believe many Alliance members have proven tools and approaches they want governments to adopt. What advice would you give them about how to approach that engagement differently based on what you've seen work in Ghana and other contexts? Abdullahi, would you like to take that first? And then Chioma, you can come in after on the embedded side.
Yeah, so on my side, I can only talk about, the research and being able to provide a sandbox environment, whether it's through open models and open data sets. For this to even work from the beginning, those services or this technology needs to be able to be localized. And I think that's where the focus should be, making sure that those services work in the local languages and in the local context. That's how you can move to the next step. That's my point of view.
Thank you. Chioma, back to you.
Yeah. So I'll give you an example of one of the things we uncovered before we started working with Ghana Health Service. And knowing that some of the innovators are introducing digital tools, So one of the things we uncovered, we noticed that in Ghana during COVID, they discovered that there were 32 digital tools developed for COVID. More than two-thirds of those tools are no longer working as at the time we joined. Some of those tools, the password, the content remained with the people who brought it in. So it was never useful to the people of Ghana. And when we came, you could now see that level of lack of trust and uncomfortability when you mention anything digital. So we noticed that. So part of the embedded assignment was how to remove that mistrust. And one of the things we did was to encourage them to have a policy or a strategy on how they intend to utilize digital health tools, so that way it becomes a guiding principle, on anything digital when we have left, so they don't need us to remain there for them to keep using that tool. So part of what we did again was to set an example with our project. So we told them there will be digital tools introduced. So you have to adopt your strategy to suit this project. And part of what they did was to develop what they call the digital alignment plan that was now relevant for our project. So that way it gets instituted, it gets integrated into their digital framework, no matter how elementary or nascent, it was at the time. So digital governance, digital policy, these are very important to protect the organization, to protect the country. So you don't have the same experience that they had during COVID, where more than half of the tools back to whoever developed it, and then some of the developers came in as if they are blackmailing the country, where you pay us this for us to release the key, So that was one of the things we did. So the suggestion to Tanzania or any country that intends to do this, in-house, you need to do your own you need to do your own homework, have your strategy, have your policy, where every digital thing could then align with, so whoever is coming in, they need to align with what you've already set out for yourself, so you don't give the impression that an outsider loves me more than I love myself. So that's exactly what we did. So right now in Ghana Health Survey, they have a digital health strategy from 2023 to 2026, I think. I can't remember. Of course, they will update that once it expires. Then for our project, they have the digital alignment template. It was made mandatory for them to have it so that they could use it to guide innovators. And that was what they had. And it helped them to continue with innovations, and then decide at the end of, the implementation, the ones they want to scale. So that's concrete example of what we did.
Thank you so much. Let me bring in another question from the questions that were submitted. And this question is from Society for Family Health in Rwanda. From your experience at AmHealth, what makes a public-private partnership truly effective in strengthening local health systems? So, who among you would like to take that?
Yeah, I can have a go. I think I'll possibly be repeating some of what Chioma's great examples Chioma's given. I think for the private partner, I think it's to allow government to define the problem, to define the use case, and to define what success looks like. Rather than to build something and then try to get government to adopt it, because then you just got a hammer and you're looking around for a nail, and as Chioma said, it's also very important to go through government processes and structures and not try to go around them. This idea that you're going to move faster. There's an African proverb, right? If you want to go fast, go alone. If you want to go far, go together. And I tell you, you'll be going nowhere fast if you try and go it alone. And I think, specifically, this last topic, I think supporting efforts around developing governance frameworks, efforts around building capacity, and not just focusing on the tool you're building, but on the broader system, and creating the conditions under which that solution can thrive, rather than just looking very narrowly at your technology. Chioma, I don't know if you'd like to add to that.
Yeah, I think you've said it all. So yeah, I think you've answered that. So yeah, I agree. I concur.
Thank you. Thank you so much. Thank you all. As we move toward closing, I would like to invite each of you for 1 minute. Given everything we've talked about, what is the one thing you most want this room to take with them about supporting country leadership and country ownership in this next phase of global health innovation? Reese, let me start with you, then Abdullahi, then Chioma.
I'm going to steal a phrase from one of our colleagues at the Zambian Ministry of Health, who says that invest in systems, not projects. Look to build the systems, including the people in the systems, rather than driving a narrow project outcome.
Thank you. Abdullahi?
Yeah, I think I just reflecting on my experience over the years. I mean, yes, there are a lot of challenges such as scarcity and so on. But what I've seen is that there's like tremendous, amazing innovation, partly due to many of those constraints. And I think it's important at the end of the day to support local researchers, and because there's so much going on, providing a platform where they can thrive as far as of the research that they are working on. I think that is critical. And for anyone to operate, I think it's important to have clarity when it comes to policy. And I think that's what also create a space for people to innovate. Thank you.
Thank you.
Yeah.
Cham?
Yeah. So country-led ecosystems are looking for true and genuine ownership and partnerships. And true and genuine ownership and partnerships are usually embedded in co-creation process. That is based on respect for the country, respect for the processes, and gaining their trust so that when you have your timelines that you want them to help you achieve, they will see you as a brother or a sister within the cultural context within which we work. Once you're not seen as a brother or a sister, forget it. You remain an outsider and nothing works. So co-creation is important and it's just something I want to leave on the table. Thank you.
Thank you. I'm seeing some really thoughtful questions coming through in the chat. Thank you so much for that. We're really, really getting close to the end of the time that we have for this session, so we won't be able to get to them. However, we're going to capture them and then we'll do our best to respond to them after the session. But thank you so much, Reese, Abdullahi, and Chioma. And thank you to everyone in the room. The questions that were shared earlier were very thoughtful and actually shaped the conversation that we had today. And also the ones that are coming in are duly acknowledged. I will close with three things I'm taking from this 50 minutes. The first is this: country-led innovation is not slower innovation. It is a more durable innovation. And that's because country-led is not a posture. It is an architecture. It shows up in who sets the outcome areas, who selects the innovators, who decides what gets integrated, and who has the authority to say yes, no, or not yet. And Choma described what that looks like inside Ghana Health Service day to day. Reese described what it requires of an embedded partner. None of it is glamorous, but it is the work that carries innovation across the same from pilot to system. The second is that the role of private sector and technology partners is shifting in a way that really matters. Abdullahi described a posture of designing with, not just for, of building infrastructure that others can build on, of meeting people where they already are, in the tools they already use. That is not just a technical choice, it is a partnership choice, and it shapes whether AI strengthens a country's innovation ecosystem or simply adds another layer around it. The third is that this next phase of country-led innovation will not be carried by one organization, one sector, or one model. It will be carried by partners who are willing to do their own work honestly, step into roles that may not always look like leadership, and leave a system stronger than they found it. So if you are in this room wondering where you fit in this transition, whether you are a funder, implementer, innovator, ministry, researcher, private sector partner, or INGO, the question I would leave with you is the one I keep asking myself. Not only what can I bring, but what does this country, this system, this team actually need me to do? And what would it look like to do that well? Thank you again to Riz, Abdullahi, and Chioma for the honesty and depth you brought today. Thank you, Abby, and thank you to the Bay Area Global Health Alliance for the room. Abby, over to you.
Thank you so much, Ota, for that wonderful wrap up of this conversation. Again, really appreciate everyone's input. dropping into the chat just a few links you can follow, and you can see some contact info from Jordan as well. But a huge thank you again to our speakers from eHealth Africa, Amp Health, and Google for your time and insights, to your participants for your engagement and questions. And we truly hope that you will stay connected and join us for future discussions and convenings. And you can also reach out to us on LinkedIn if you don't know us, or via email if you do. Wishing everyone a wonderful rest of the day or evening. Thank you so much.